Happy Rare Disease Day, everyone. I'm Paula Eichenbrenner, TMA's Executive Director, and here we are on the last day in February for the TMA, MIHRA, and Nori's Fight We Care for Rare virtual summit. Over the next 2 hours, we're going to celebrate the very best in myositis science, and we're going to hear some really inspiring and powerful patient stories. Thanks for joining us live on Zoom. We also are setting up a YouTube broadcast link. While that's underway, I'll turn it over to TMA's Board of Directors Chair, Lori Boyer, for the official welcome to today's program. Lori, over to you.
Good afternoon, everyone. Thank you so much for joining us today. What an exciting day to be together on Rare Disease Day 2025. So we have wonderful organizations that have come together today to make it possible. So I just want to start by saying thank you to the Myositis Association team, the MIHRA team, and Nori's Fight. Without you, this day would not be possible. Next. All right, so we are here for the We Care for the Rare Summit. And when you look at Rare Disease Day, it was actually established in 2008 by Eurodis. And Rare Disease Day takes place on the last day of February each year. And today it's the culmination of Rare Disease Week. So many people have been taking part in lots of great activities this week to elevate the rare patient voice. This slide is a selection of some rare things. So four-leaf clovers are believed to be lucky, as the fourth leaf is the result of a genetic mutation in the plant. In addition, people with naturally ginger hair only actually make up 2% of the world's population, making it a rare hair color. The chances of an all-white peacock being born is 1 in 30,000, making it a rare species of the bird. So like the things in these images, rare diseases are uncommon and hard to find. A disease is rare when it affects fewer than 1 in 2,000 people. Next slide. All the various forms of myositis are rare. Only 50 to 70 out of 100,000 people live with a form of myositis. Myositis is a term for illnesses that involve chronic muscle inflammation. Myositis refers to several different illnesses listed here on the left side of the screen. Myositis diseases are autoimmune in nature, so they are among the nearly 200 autoimmune diseases, and 3/4 of all autoimmune diseases are rare. Due to the wide diversity of myositis types and the presence of relatively common symptoms that can mask one another with the underlying diseases, misdiagnosis is common. Moreover, symptoms not only vary between different forms of myositis, but can also differ among patients with the same condition. So today is a chance to call attention to myositis and to support the families navigating rare medical journeys in myositis, as well as the teams who care for them. Next. Living with rare disease such as myositis is complex. You'll hear more about this from our keynote speaker later today, a dermatomyositis patient, Lindsay Gunsell, when she closes our program. A special thank you goes out to all of the care partners who help our patients navigate the daily demands of this disease. Speaking as a former myositis care partner myself, I see you and I thank you wholeheartedly. Next. Collaboration in research is vital to connect researchers and clinicians, ensuring progress in diagnosis, treatment, and care. We're grateful to the physicians and scientists and lab coordinators and research teams who do such an incredible job with this work. We want to express our appreciation to the dedicated professionals at NIH, FDA, HHS, and all the US federal agencies working to improve public health. TMA stands with you when we say rare diseases need more research, not less. In the myositis community, when it comes to the NIH, we are particularly grateful for the scientific advancements powered by NIEHS, as well as NIAMS. TMA was dismayed, but not defeated about the NIH FDA postponement of the Rare Disease Day program originally scheduled for today. However, we immediately sprung into action with wonderful peers such as MIHRA and Nori's fight. Like the members of our community who rise again and rise above, no matter what myositis is doing to their muscles, TMA, along with our collaborators in research and patient advocacy, are proudly offering today's We Care for Rare Summit, celebrating myositis science and patient stories on Rare Disease Day. Just a couple quick before we move on, a couple quick housekeeping items. There is a Q&A model in the Zoom, you'll notice. There'll be limited time for us to answer all questions, but please feel free to put those in there and we'll do our best to follow up to get all answers out to you. In addition, this is not an Ask the Expert program. This is an opportunity to share out myositis research. And also be cognizant, since it's webinar style, to make sure you mute yourself during the presentations. And we look forward to just an absolutely wonderful day. So I'll pass the mic over there to Paula as she takes our group photo.
Thanks, Lori. And we are going to pull down the screen share and take a group photo with as many myositis zebras as are willing to turn on your camera. It's optional, of course, but if you'd like to join the group photo, please turn on your cameras and join us. And I'm maxing out the screen size, and I will have to click around and take a few shots, okay? So everybody hang in there, just keep smiling. 1, 2, 3. Okay. We're taking a group photo, so everybody keep smiling. It's a large group photo. It's quite a big family reunion. Wouldn't you say, Lori?
Absolutely.
This is, in fact, the largest turnout for a virtual program that TMA has had in possibly ever. We'll have to get back to you on the exact numbers once we shift out of Rare Disease Day pop-up summit planning mode, but it's certainly an impressive turnout. Last group picture, okay. We're gonna stitch this all together in the post-production and make one big collage. Go ahead, Lori.
It's like we're a really big Brady bunch. It's the Mayo bunch.
I just love that a big group of zebras is called a dazzle. And I just really sense the myositis community dazzling today. Thanks for your patience with us on that group photo. And so thank you also to Lori, our board chair, for that excellent welcome. And to kick off the scientific portion of the program, I'm very pleased to introduce TMA Medical Advisor and MIHRA Chair, Dr. Leslie Sackett-Koo. Leslie will be speaking to us about rare disease action and pride, along with Dr. Pedro Machado, MIHRA co-vice chair, and then we'll have reactions from Lori, as well as Dr. Namita Goyal, TMA Medical Advisory Board chair, and also from all of you. You know, as Lori said, we encourage you to use the Q&A box and the chat. And we're looking forward to spending the next couple of hours together. So Leslie, again, with TMA's really deep gratitude for the MIHRA partnership that has made these super exciting myositis flash science talks possible. I will pass the mic and the screen share over to you.